Hi, I'm Laurel. I'm the Director of Veterinary Health here at the Pasadena Humane Society and SPCA. Today we're going to be talking about disease in the shelter, and that includes disease, sanitation, and medical information for the volunteers. So why should we care about infectious disease? Infectious disease causes suffering. It's easily spread and it's hard to control. It may lead to euthanasia. It definitely creates staff and volunteer frustration. There is cost involved and lots of time for treatment, and we would get a poor reputation if our shelter was full of sick animals. And we also have limited isolation space, where we don't have the space to hold many sick animals at a time. Why does disease happen in shelters? Grouping of cats and dogs of different ages and susceptibilities, and overcrowding, our inability to quarantine, constant introduction of new or unknown animals with unknown or medical or vaccine histories, open access to the public, limited resources, stress is a big factor for all of the animals here, required holding periods, and diseases that we're seeing out in the community, and those can change by season. Stressors. The stressors that we see most often leading to disease is transportation, so bringing in animals to the shelter from other shelters, handling and restraint. Noises are stressful for animals, smells, other cats and dogs, lacking control, irregular schedules, temperature changes, drafts, overcrowding in the shelter, isolation, and pretty much anything unfamiliar or unpredictable for this animal, which is the shelter environment. Most animals are not used to being in the shelter, and it's just a stressful environment for them to begin with. Without these other factors. General principles of infectious disease control. So we want to have appropriate segregation and separation of pets. We need good cleaning and disinfection practices. Mass vaccination, effective removal of infected animals, and education for our shelter staff, the volunteers, and the public. Health-related shelter goals. Adopt as many healthy animals as possible. Minimize disease and problem behaviors. Prevent transmission of zoonotic diseases. Isolation or foster care for treatment. We do try to send out as many animals as we can to foster care. That does alleviate our burden here of how many animals we have at a time. Quarantine versus isolation. What is the difference between isolation and quarantine? Isolation is for animals that are already sick, and quarantine is for those animals that may have been exposed. And both of those areas are off limits to volunteers. How are diseases transmitted? Not all diseases are transmitted the same way. Some diseases are transmitted with direct contact, so coming into direct contact with other animals or carriers, and a carrier can be a human, or it could be another animal. Also inhalation, just like you or I would get the common cold, they can also inhale particles that cause them to become sick. Ingestion, fecal or urine contamination, secretions or excretions. Vectors, which are fleas, ticks, and mosquitoes. And fomites. We're all fomites. We all carry we can carry disease on our clothing, our hands, and even inanimate objects like bowls can be fomites. Animal disease spread. So do your best to stop the spread of disease by making sure to keep the dogs that you're walking close to you as you walk them through the kennels or past other dogs on walks. Also, not allowing more than one animal in a play area or kennel unless otherwise instructed by staff. Refraining from going kennel to kennel and petting animals through the kennel bars. I know that's really hard not to do, but that does spread disease, so we want to refrain from doing that. It's really important that between kennels, you sanitize your hands, you wash them well, and you do wear gloves in between every kennel. And you also, by stopping the public from doing that and touching between each animal, will really help cut down on the spread of disease. Also, cleaning up after animals in any of the yards, communal areas, etc. Always carry poop bags along with you. Again, wearing and using new gloves when cleaning each kennel, using different and clean toys with each animal, and washing your hands between each animal interaction. So again, I want to make that clear, is that it's very important to wash your hands between each animal interaction. Report any signs of illness to volunteer services or health staff. So you can go right to either Sarah and report anything that you notice it to be unusual, or come straight to any member of health staff in Scrubs, and we'll be happy to go take a look at that animal and have the doctor check them if necessary. So what is a fomite? A fomite is an inanimate object, such as a toy, food, bowl, water bowl, or a mop even, that may become contaminated with infectious organisms and serve in their transmission. So almost anything can become a fomite, and just keep that in mind when you're working with each animal. Again, anything can be a fomite. Kennels, cages, transport carriers, windows and walls, lobbies and halls, doors and doorknobs, play yards, vehicles, exam tables, bedding, toys, food and water bowls, litter boxes, scoops, brushes, mops, clothing and footwear, ventilation ducts, phones, keyboards, etc., and hands. Your hands are one of the biggest fomites because, again, like I talked about in a previous slide, going from kennel to kennel only can transmit diseases if you're not washing your hands in between them or wearing gloves. Limiting the amount of germs. So the way that we limit the amount of germs in the shelter is with cleaning and disinfection, and we're pretty strict on our protocols. We isolate and we treat our sick animals, and obviously with prevention, which is what we hope to convey to you with this slideshow, and preventing the diseases from happening in the first place. Cleaning and disinfection. This is one of the most important, if not the most important, aspect of controlling infectious disease. So step 1 on cleaning. Remove organic material such as feces, detergent activity, soap it up, and mechanical cleaning, scrub away. Disinfecting. That's step 2. Deactivate disease with appropriate disinfectant, Excel or kennel care. Every area is going to be different, and some areas we do use Excel, and which is now called Rescue, or kennel care. It just depends on the area. So if you have a question regarding that, you can ask whoever's working in that particular area, and they'll be able to tell you what we use. These need to be applied to a clean surface, and their minimum contact time is 10 minutes. The order of cleaning. We clean the cleanest first, and then we go down to the dirtiest. Again, so that's the least contaminated to the most contaminated areas. We clean the most vulnerable first and the least vulnerable last. So more about cleaning and sanitation protocols with dogs. Toys, leashes, collars, and kneelers need to be disinfected after use. Throw away any soiled plush or cloth toys, and bring their dirty bedding to the laundry. If soiled with diarrhea or blood, throw that away. Take small slip leads to the laundry after use for washing. Fill sinks in the behavior kitchen with hot water. Add the instructed amount of kennel care disinfectant, and you can do that by reading the label to see what's required. Let toys, thick leashes, and collars soak for 10 minutes, then rinse well with water and put items on a rack or towel to dry. Kneelers, thick leashes, and collars taken from the volunteer office should be left to dry upstairs near the balcony railing. Wipe down kneelers with kennel care and damp cloth. Plush toys should be run through the plush toy spinner to drain the excess water. Always put away any dry toys in their respective labeled tubs. And again, wash your hands. The cleaning and sanitation protocols for cats. Do a visual observation first of the kennel and the cat before the entering. Pay attention to any signs of upper respiratory infections. So if you notice that the cat might have runny eyes, if they're sneezing, that's a potential red flag. Glove up and gown up, and use separate gloves for each cat. That's very important. Separate gloves, again, as we've talked about before. I hate to reiterate the same thing over and over, but using separate gloves for each kennel is very important. Use an old food bowl to scoop out soiled litter pan over the garbage can. Refill the litter pan with new litter if needed. If the litter pan is heavily soiled and can't be cleaned, discard it and replace it with a new cardboard pan. Shake out the bedding and return it to kennel. So you're obviously going to shake it out over the trash can because lots of little pieces will fly off when you're doing so. However, if it's soiled, just go ahead and replace it with a new towel and or bed. Throw away any item that has loose stool or vomit on it. Just throw that right in the trash. Otherwise, you can toss the dirty towel in the laundry bin. Spray hand towel with the Excel with a 1 to 32 dilution and spot clean the entire cage, making sure to clean any urine or fecal matter as well as spots on the glass. And it's very important also to get the areas of the kennel, the front of the kennel can be really hard to clean, but that is a really important area that we need to get clean as well. If you need to change or refill the water, please use a sink in the kitchen and throw out any cloth or crinkled toys that are soiled. We can actually sanitize the plastic toys, so those can be saved and placed in the kitchen sink to be sanitized. Lock the cage door, throw away your gloves, and wash your hands. Again. Always wash your hands. So again, we're going to go over this because it's so important that we want to reiterate it. Wash your hands between interactions with each and every animal. Good old-fashioned soap and water is what we use. We request that you use at least 30 seconds of contact time and scrub those germs away because we don't want you being a fomite. What about hand sanitizers? Hand sanitizers don't work with organic debris like feces, and it doesn't work well against viruses like parvo. It's only effective if rubbed on the hands for a full contact time of 20 to 30 seconds. So if as a last resort, yes, we have hand sanitizer and it's good in a pinch, but we request that you always wash your hands between each animal rather than hand sanitizer. So just some general cleaning and sanitation principles. The more porous, like cloth, or more organic, like feces, the material, the harder it is to clean. Some organisms are really hard to destroy and get rid of, and we use our products that specifically for that reason because they're made for these type of organisms and in the shelter. It's really important to follow the correct order of cleaning, as we talked about earlier, and use the appropriate cleaning equipment. And when you're doing the laundry, hot water and bleach, if heavily soiled, throw it away. We don't need to keep them. We do get a lot of donations of towels if we start running low, so we don't want to risk disease by just keeping heavily soiled towels. If you're in doubt, just throw it out. What about vaccines? So what are vaccines? Vaccines are health products that trigger protective immune responses in pets and prepare them to fight future infections from disease-causing agents. So basically, vaccines prevent disease, and they build up the immunity within the animal to protect them against the disease. The vaccines they're not actually antibodies themselves. They don't give instant immunity, and they're not a guarantee. They're also not for every disease. So There is not a vaccination, unfortunately, available for every disease out there. Just as like in humans, we don't have a vaccine for every disease. How we do a health check for our shelter animals. All the shelter animals are first health checked by the health staff. We check the animal's skin, ears, eyes, teeth, weight, age. We give them a good exam when they come in. And if they feel, our health staff feels that there's something wrong with this animal, whether it be cardiovascular, digestive, orthopedic, maybe they're in pain or there's some other serious issue, like a mass maybe, they're going to request a doctor check on that animal. And the shelter veterinarian will take a look at them. Upon intake, all the dogs are vaccinated against distemper, parvo, bordetella, which is kennel cough, and rabies. And upon intake, all cats are given the FERCP vaccine, and that protects against panleukopenia and 3 other diseases. All dogs and cats are dewormed, and they're given a topical flea and tick medication. And when we have an animal that comes in with long nails or a matted and dirty coat, they might get a nice grooming from our volunteer groomer. And all cats are given a nail trim. So some red flag signs to look out for and that you want to report to staff if you see them. Let us know if you see any dog or cat coughing, vomiting, diarrhea, discharge from any orifice, sneezing, coughing, lethargy, so they're really, really tired, not just tired because it's hot outside, but just they don't want to move tired. Extensive scratching. Some scratching is normal, but if you see a dog that just can't seem to get enough or they're rubbing themselves and they can't stop, that's something that you want to report. Worms or any other parasite, definitely report that. Smelly or dirty ears, hair loss, bald spots, lumps and bumps, and when it comes to urination, if they are straining and nothing's coming out, or maybe just little bits, or even if there's blood in their urine or in their stool, that's something that we would like you to report. So if you have any question, and you're not sure about it, just report it, because it's better to be safe than sorry. So some potential diseases that we see here in the shelter, the number one is URI, which stands for upper respiratory infection. We see a lot of URI, mostly in our cat population, but also in our dog population. We see parvoviral diseases in both dogs and cats, canine distemper, mange, ringworm, hookworms and roundworms, and GI infections. URI, upper respiratory infection. That's caused by viruses and bacteria that affect the nose, back of the throat, and the trachea, or the windpipe. It affects both cats and dogs. It's highly contagious, and it's usually limited to the upper respiratory system. Usually the ones that we see here are pretty mild, and they recover well. Usually they don't need to be on any kind of antibiotics for them. They usually recover on their own. But sometimes the symptoms that we see are sneezing, runny nose, runny eyes, coughing, and they just don't feel well. It's kind of like your average cold that the human gets. Sometimes it can get worse and it turns into something different, but normally they're pretty mild. Again, URI is very, very common. We see it mostly in cats and in dogs as well, but cats, it's caused by infection or stress. And so again, going back to one of our first slides, all of the animals coming in are stressed out. They're in a new environment. They're in a different environment here that they've ever been in, and they're stressed out. And so that's why a lot of the cats here do get the URI. It is worse in kittens. They get sicker easier since they don't have the immunity built up yet. So we do keep a closer eye on them, but it is very, very common. We see it all the time. URI in dogs. We do sometimes see kennel cough, otherwise known as Bordetella bronchoseptica. Most dogs get sick 1 to 2 weeks after being exposed. They have a loud, harsh cough and nasal discharge. Sometimes it sounds like they're trying to cough something up, and it can be contagious for quite a while. Another one that's also an upper respiratory infection but much more serious is the canine influenza virus. This is a newer disease in dogs. We're just beginning to learn more about it, and we do have a vaccination for it now. We don't vaccinate our shelter dogs for it because of how long it takes for it to become effective, but there is a vaccination available. It's caused by their own flu virus. It's not something that people can get. You're not going to be able to catch a flu from the dog. They get sick a few days after being exposed. They have a harsh cough, nasal discharge. Sometimes they do have a fever as well, and they are not usually contagious after about a week. How do we treat URI here at PHS? We move an animal to the sick ward to avoid spreading disease. So we do try to move them to isolation if we have room and if it's severe enough. Again, most URIs, especially in cats, are pretty mild, and so we just try to get them better as soon as possible. We try to reduce the stress, give them lots of tender, loving care. Most get antibiotics. Again, that only helps with bacteria, so not with the viruses, so it depends on the severity of the URI. Most will recover, but just need some time, and in the meantime, we avoid other animals. We try to send them out to foster care, and we do not schedule them for surgery until they feel better. So what's okay and what's not okay for cats and dogs with URI? What's okay is they're coughing, they're sneezing. They have clear to yellow-green nasal discharge and a slight fever. What's not okay? So if they have no energy, they don't want to eat, they have a very high fever, they're having difficulty breathing, they have a bloody nose, or they're coughing up blood, or if a cat is significantly drooling, those are some signs that are warning signs where we need to take further action, whether it be changing their antibiotic or doing a different treatment plan. And we need to be notified of that as soon as possible if you notice any of those symptoms. So parvoviral infections. This is something that we don't want to hear about at the shelter because these are very contagious and very damaging diseases in our population. Canine parvovirus causes disease in dogs, and that is called parvo. And feline parvovirus in cats is called panleukopenia, mostly referred to, or feline distemper. They are severe and they are often fatal disease caused by these viruses. They affect cats and dogs. They're highly contagious and easily spread. This virus destroys the lining of the intestines. It results in vomiting, diarrhea, dehydration, and electrolyte problems. Unfortunately, it wipes out the bone marrow and decreases white blood cells so that the immune system has a hard time fighting the infection. It can damage the developing brain tissue if mom gets infected while pregnant. Signs of parvo in cats are depression, weakness, vomiting and diarrhea, often foul smelling. We know that all vomiting and diarrhea smells bad, but this is especially bad. Dehydration, temperature extremes, they can go from hot to very cold, and sudden death in kittens, but adults might not get that sick. And in dogs, decreased activity, vomiting and diarrhea, again, often foul smelling, and it's usually bloody as well. Dehydration, fever, and abdominal pain. So what's the treatment for parvo? It's intensive supportive care. They need outside veterinary care and isolation. We have a hard time treating parvo here because it is so contagious and it needs such strict care to be given 24 hours a day. They need rehydration, correction of electrolyte abnormalities. We need to try to control the vomiting, and they need good nutrition. We also try to prevent secondary bacterial infections from occurring because they may get blood poisoning, otherwise known as sepsis, and they need a broad spectrum antibiotic. Distemper in canines. So distemper is a viral infection of dogs that is spread by contact with body excretions, so feces, mucus, etc., of infected dogs. Clinical signs are respiratory and gastrointestinal disease. That's the most common initial signs. And then neurological signs may follow a couple weeks later. What you might observe with a dog that has distemper, problems with the eyes, problems with the brain, GI problems, so stomach upsets, reproductive problems, respiratory breathing problems, and skin issues. So these are some of the clinical signs, again, of the previous slide. So GI, they're going to have loss of appetite, vomiting, diarrhea. Neurologic, they might be have twitching muscles, seizures, fading puppy syndrome, stillbirth and abortion. Respiratory, they can have nasal discharge, coughing, sneezing, difficulty breathing, and pneumonia. And in their ophthalmic and their eyes, they're going to have eye discharge. They could have sudden blindness, or they might have cloudiness in their eyes. And in dermatologic, you can see the pictures down below there of these odd-looking paw pads. They're swollen, they don't look right, and the crusting on the nose. So the prognosis for dogs with distemper with neurological signs is extremely poor. Dogs with GI and or respiratory disease may recover, but they need to be isolated for a month after they recover. We need to protect unexposed or unvaccinated dogs for 3 months after recovery. And neurological signs may develop up to 3 months after they've apparently already recovered. So you can see that distemper is also another really nasty virus that we don't want to see here at the shelter. Sarcoptic mange. It's a highly contagious skin parasite. You can see this picture here of this poor dog. It's transmitted by direct contact or by fomites. It causes severe itching and redness, crusting, hair loss of the ears, elbows, and hocks. Zoonotic diseases. So a zoonotic disease is an infectious disease that can be transmitted from animals to humans. And yes, that is scary because these are diseases that you can pick up from animals here at the shelter. Some of those do cause severe disease, most do not, but it's really important to practice good personal hygiene, wash your hands, and use our personal protective equipment that we provide if we suspect that a zoonotic disease might be present. So obviously the one that we worry about most is rabies. Rabies is a zoonotic disease. It's most commonly found in developing countries, but we do have it here. Our wildlife department does see it in bats on occasion. So it is around. The symptoms include pica, fever, seizures, paralysis, hydrophobia, drop jaw, inability to swallow, lack of muscular coordination, hypersalivation, excessive excitability, unusual shyness or aggression. All dogs are vaccinated against rabies when they're adopted from PHS. There is no known cure, but preventative vaccine for humans is available. If you get bit, it's very important to report it right away and just let somebody know and then go seek treatment. Ringworm. This is a very common skin infection, and it is probably the most common that we see, especially in cats. Dogs do get it too, but less frequently, and it is zoonotic. It can be passed from animals to humans. It's really common here, and we do see it pretty often. It's hard to get rid of in a shelter environment because of the long incubation period, and the spores, they can drift to many places. They can get in people's hair, they can get on clothing, and even if you don't get ringworm, you might take it to another area of the shelter, and those spores can attach to another animal or another person and cause infection. Hookworms and roundworms. They're parasites of the small intestine. They are treatable with medication. Hookworms spread throughout the ingestion of larvae or penetration through skin, usually in the belly and feet. So some signs of hookworms are diarrhea, weight loss, anemia, and a bad itching sensation that leads to really extreme discomfort. Roundworms, that's usually caused by ingestion of eggs. And a lot of the time when kids eat dirt, that's why it's more common in kids, they'll eat some of those eggs and they get diarrhea, there's poor growth, and they get a pot-bellied appearance. So some more zoonotic diseases here that are stomach and intestinal infections would be toxoplasmosis, giardia, cryptosporidium, hookworms, roundworms, salmonella, and campylobacter. They generally cause discomfort, vomiting, diarrhea, and dehydration, and they're spread by ingestion of fecal matter. So if you're not wearing gloves and you get some feces in your nails or just on your hands and you don't wash your hands and then you go have lunch, that could be a problem. That's why it's so important to not only wear gloves, but also, again, wash your hands. So other zoonotic diseases here, cat scratch fever. It's a bacterial infection spread by a scratch or a bite from a cat. It doesn't usually cause a lot of symptoms, and if they do, they're pretty mild, but it's important that if you do get scratched by a cat, you need to see your doctor. Another one is leptospirosis, commonly known as lepto. It's a bacterial infection that's spread through the urine of infected animals, and that's in dogs, raccoons, and rodents. It causes flu-like symptoms and kidney and liver damage, and it's more common in developing countries, although we do occasionally see a case here in our area. Just a friendly reminder, pick up the poop first. Spraying with the feces with a high pressure hose can spread the virus, so we always like to pick up poop first. Disinfectants, especially bleach, don't work on organic matter like feces, so pouring bleach on the feces or down the drains is useless. That's why we use Kennel Care or Excel. Contact time is critical. Disinfectants must sit for at least 10 minutes before rinsing, and more bleach is not better. In higher concentrations, bleach is a severe respiratory irritant, and we don't want your respiratory system getting irritated. So just be conservative on the bleach. There are some times that we do use it for different reasons, but be cautious when using it. It does irritate the nasal passages in the eyes, and it can cause respiratory infection for you and our animals here, and it also damages the facility. So what to do in the shelter? Again, be sure to wash your hands between the animals. Always wash your hands. Thoroughly clean and disinfect to reduce transmission, and that includes cages, carriers, food and water bowls, toys, etc. Again, anything is a fomite, so we want to practice good disinfection protocols. Bring any sick animal to the attention of staff. So again, you can find a member of health staff. We are in scrubs. Or go to the main office and say that you'd like to report a sick animal to the health staff. Again, you can also talk to either Sarah in volunteer services, and they can get in touch with us as well and let us know. So when you're reporting a sick animal or an animal that you have a concern about, please be sure to write down the animal's A number, which is their identification, and their kennel number, and give that information to the staff. Now, when you get home, take off your shoes before you enter your house. If you can, you may want to wear a pair of special shelter shoes, because shoes are a huge fomite. When you leave the shelter, you're probably tracking something home with you. So it's important that take them off outside, or just keep your separate pair of shelter shoes. Wash your hands again, especially before you touch your own pets. Change your clothes. That's a really important one, because again, we've talked about fomites, and you can carry things home to your pets at home, or even potentially other things. So you want to change your clothes as soon as you get home, and make sure your pets are up to date with their vaccinations. Don't forget, each year you're entitled to free vaccines for 2 of your pets if you complete 50 volunteer hours. So we would be happy to help you with that and protect your pets so that they don't get sick. If you see a sick or an injured animal, please immediately find a member of health staff in scrubs or go to the main office and say that you'd like to report a sick animal to health staff. Again, be sure to write down the animal's A number and kennel number and give that information to staff. These are urgent matters, so going to the Sarah's in the volunteer office might take too long of a time. So if you can and you see somebody in severe distress, you can ask any member of the PHS staff to page a member of health staff for an urgent call if you can't find a member of health staff in scrubs. Some of those would be, they're struggling to breathe, they're gasping, they're turning blue. If they have excessive or uncontrolled bleeding, they're very lethargic, they're unable or they can't move, they're not responsive to your voice or your touch, or if you notice that they have significant wounds or swelling on them, if they're having a seizure or notice that they had a seizure, and then diarrhea and vomiting as well. We need to be notified as soon as possible, if not immediately, as soon as you can find one of us. And again, any member of the PHS staff can help you find one of us or page us. So thank you for taking the time to stay with me through this presentation. Obviously, we care so much about our animals here, and we just want to keep them healthy, and we want to keep you healthy. So following these protocols and procedures are super important to us. We welcome any questions you might have about disease, disinfection, or sanitation. You can ask any member of health staff and, of course, volunteer services. We would be happy to answer your questions. And again, please wash your hands and have fun out there.